Hi, I'm Doug Phillips. I'm going to be talking to you for the next 45 minutes about cervical lymph nodes, and we're going to talk more about nodal disease by including a discussion of head and neck lymphoma. So what we'd like to accomplish in the next 45 minutes or so, discuss the anatomy of cervical lymph nodes, talk about what's normal versus an abnormal lymph node. That's typically the question to us. And then we'll discuss some of the entities in the head and neck, primary lymphoma in that region. We'll also describe a few other nodal diseases as we go through. So let's begin just kind of like overall with a perspective. Cervical lymphadenopathy in an adult patient. What are we talking about? The picture on your screen is a picture of Ulysses S. Grant late in his life when he had retired to the Jersey coastline to write his memoirs. It's middle of summer, and he's wearing this very long, kind of obscuring cloak. And the reason why is during the Civil War, he smoked a lot of cigars and ended up in his older years with a head and neck cancer. He actually had tongue-based squamous cell carcinoma, and the nodal disease became so large and so disfiguring that to sit on his porch, he found it a little off-putting to have people looking at his neck. So he wore this cloak to kind of cover his lymphadenopathy. So when we think about cervical lymph nodes in a typical adult patient, we're basically thinking about cancer. And the fact of the matter is that over 90% of head and neck cancers are squamous cell carcinoma. Overall, the most important prognostic factor in squamous cell carcinoma is the presence or absence of metastatic lymph nodes. That is why we image these patients to a large extent. The presence of a single cervical lymph node has been said in some studies to just about half your survival. If disease has spread outside the nodal capsule, it significantly decreases survivability. Some people say about 15% overall survivability. That's significant. We want to know about lymph nodes. So what do normal lymph nodes look like? And the fact of the matter is that somewhere between 60 and 75% of the nodes in the normal human body are in the neck. So in doing a CT of the neck or an MR of the neck, we're going to see a lot of lymph nodes. And normal lymph nodes have this kind of lentiform shape that's a little bit like a kidney bean with a fatty hilum. They are all discretely well-circumscribed soft tissue masses, typically within fat in the head and neck. And on our post-contrast examinations, they will demonstrate very minimal homogeneous enhancement.